November is Epilepsy Awareness Month, and nearly 140,000 people in Chicagoland have epilepsy.
UI Health's Dr. Serafini and Dr. Pucci join us now with how they work together to help patients whose seizures aren't well managed with medication. Thank you both for being with us.
Thank you for having us.
Okay, that number that Sarah just mentioned is pretty staggering in terms of people affected by epilepsy. And what we find very interesting is that UI Health has a level 4 comprehensive unit, right?
Yeah. It's the highest level of the epilepsy recognition. So it's recognized by the National Association of Epilepsy Centers, and it means that we can do surgeries for epilepsy. So, and we do this for patients who have drug-resistant epilepsy, so they continue to have ongoing seizures, which are disabling because they cannot sometimes drive, keep a job, have a family. So it's really a huge impact on their lives. It really affects their quality of life.
And Dr. Pucci, you are a neurosurgeon. What does it mean when you hear somebody say that you are drug resistant in epilepsy?
So typically that means somebody has tried to anti-seizure medications and they're still having seizures despite that. So there are a lot of great advances in the medical management of epilepsy and new medications. But once somebody tries a couple of medications and that's not working, the chances that continuing to add medication or change medication will result in elimination of their seizures is very low. It's maybe like 3-4% after like a year of trying this. So in those patients, a lot of them can really benefit from surgery for epilepsy. So out of all of the patients that have some type of surgery for epilepsy, we can completely eliminate seizures in half, about 50% of those patients. And in some particular common types of epilepsy, for example, seizures that come from the temporal lobe are very common. We can get rid of seizures in like 70 or 80% of those patients. So it's a really important and powerful tool in those patients that are drug resistant.
And Dr. Serafini, we find fascinating at UI Health, you run women in epilepsy program.
It's a really big passion of mine. I really like to take care of the women with epilepsy. It's very important that specific patients that have epilepsy, they have unique needs. So women have their own challenges, and because of the hormone changes throughout their life, because of pregnancy. So in my clinic, I usually discuss all those things, like how seizures can be affected by hormones, how anti-seizure medication can interact with birth control. And I start talking about family planning very early, because we really need to pick the best medication that will be very safe for a possible future pregnancy. And then I work with MFN doctors, the OBs, to try to get them through pregnancy in the safest way possible and have a healthy baby, have a healthy pregnancy. And patients need to know that it's possible. Even if you have epilepsy, you can have a healthy pregnancy and a healthy baby.
You are working so well as a team at UI Health. I mean, you're working with the OB, but then the two of you together as well. How do you work together as a team in your everyday work?
I think it's very important that there's such a strong collaboration. It's team effort. It's between neurosurgery, neurology, but also between neuropsychologists, neuroradiologists, and we really have to have a common goal, that is getting the patient seizure-free. And we do this through multidisciplinary meetings where we discuss the cases together. And I really like the fact that we often see patients in clinic together. And I really think that helps build that trust with the patient.
I mean, this sounds like world-class care.
Oh, yeah, absolutely. I mean, I think there have been a lot of technical advances in surgery, too, to make it an easier experience for patients. A lot of the surgeries that we do now are minimally invasive. So one of the very common surgeries we do for epilepsy is called stereo EEG or SEEG. It's called that because we're mapping where seizure activity comes from the brain in sort of 3D, like stereo surround sound. So we actually place very, very small electrodes, or kind of like soft wires, into the brain that are just like 1 millimeter in diameter.
So these are implants?
Yeah, but just temporarily.
Okay.
So we place them without the need for like an incision or what we call a craniotomy, where we open up a window of bone into the brain. It doesn't require that. So we just place these 1 millimeter electrodes into the brain, and then we map exactly where seizures are coming from. And we map important functions like language function, and then we remove those. And in that way, we can sort of identify where we need to operate and what options we have to try and get rid of their seizures. So I think a lot of these surgeries don't have necessarily the same type of recovery time or long hospital stays that people needed in the past.
Unbelievable. And
Incredible.
helping so many more people. Dr. Anna, Dr. Francesca, thank you so much for being here. We appreciate it. For more
Thank you.
information, all you have to do is scan the QR code right there on your screen. Head to epilepsy.uihealth.care. You can also find them on Facebook and Instagram. Loads of information there for you.
Thank you so much for being with us.